Okay, welcome back. We're doing part 2 today on regenerative medicine in regards to banked regenerative products. So there's quite a few biotech companies in the US that are following rigorous FDA standards in terms of cleanliness to take planned births, so moms that are healthy and have been pre-screened and are willing to, I'm not sure if their placentas or umbilical cords are donated or sold. I'm not really sure how that happens, but basically at the birth, in the past, the placenta and the umbilical cord was put in the trash, and now we're realizing how much products that help the body regenerate are in the umbilical cords and placenta. So these biotech companies take these two parts of the birth process, the afterbirth, and the umbilical cord, and they basically clean them, and it's called minimal handling. So they minimally clean them and take out something that's called Wharton's jelly, and Wharton's jelly has been scientifically in the scientific literature, I think since the 20s or 40s, 1920s, 1940s, so almost 100 years. And there's been, studies done on what's in there. So basically there's mesenchymal stem cells that are in there. And also now in the recent, probably in the last 10 years, there's recent scientific research showing that it's not just the stem cells that are giving regenerative processes. There's something called paracrine factors. Paracrine factors are other parts of these banked products, and some of them are called exosomes. Now, again, so there are cells that are living in these products, and there's other paracrine factors, and some of them we know are called exosomes. So what are exosomes? Exosomes are really small particles that cells make that have messenger RNA, they have lipids in them, they have proteins in them, and they've been shown to add to the growth capacity of these materials. So how do we use them? Well, again, this is a new frontier in medicine. So there's a lot of research being done on it. I think actually the government Institute for Health and Research just gave like $130 million to study exosomes and what exosomes are good for. Again, in our clinical practice, we've used both the stem cells and we've used exosomes. We've used PRP that we talked about in the previous video. We've used prolotherapy solutions. All of them are good. All of them work. Some are going to work better in some patients. For instance, if somebody has really a lot of cartilage loss, if there's a lot of cartilage loss, probably the most potent regenerative factor is going to be the stem cells, because they have a structural ability to rebuild cartilage and so forth. Again, just one quick thing on this: the FDA has not cleared any of these products for any treatment. They are being used across the globe for different regenerative processes, and including autoimmune issues, degenerative joints, pain, neurologic issues like Alzheimer's, Parkinson's, developmental illnesses like autism or learning disabilities. There's a lot of research going on in this field, and it's just an exciting field to be part of. So we welcome your questions and your interaction, and please share our video with your friends, and like us on Facebook, and thank you again for watching.